Hello, I'm Dr. Anita Hill. I was a practicing haematologist for over 2 decades with experience in managing people who are living with PNH. I've served as a physician for the United Kingdom's National Health Service, as well as the lead clinician for the UK National PNH Service. Today, I am the Vice President of Global Medical Affairs, Haematology and Nephrology and Clinical Development for Alexion, AstraZeneca Rare Disease. In this video, we'll take a closer look at paroxysmal nocturnal hemoglobinuria, or PNH, what causes this rare disease, how a part of the immune system called the complement system plays a role, and certain complications to look out for. The name of the disease, paroxysmal nocturnal hemoglobinuria, means intermittent, at night, hemoglobin in the urine. It was thought that PNH was more active at night because some patients experienced dark-coloured urine in the morning. However, we now know that it is active all the time in nearly all patients. Therefore, although PNH is a descriptive name, we know that the disease is not intermittent. The complement activation I will describe shortly is happening 24 hours a day. In order to explain PNH, let's begin with where it starts, the bone marrow. The bone marrow, which is inside our bones, is a very important organ because it produces all the blood cells that circulate in our bloodstream. Some very important cells in the bone marrow are called stem cells. Stem cells are essential because not only do they produce more of themselves, but they also go on to produce the 3 main components of blood. These are the red blood cells, which carry oxygen around the body, the many different types of white blood cells, which fight infection, and finally platelets, which are needed for blood clotting. When looking at a sample of someone's bone marrow, these cells should appear to be growing or maturing. When they're fully mature or fully grown, the blood cells get pushed out into the bloodstream. Now, in order to understand PNH, let's first talk about another condition. Typically, our immune system helps us fight foreign organisms, such as bacteria and viruses. Unfortunately, there is a condition in which the immune system mistakes our stem cells for bacteria or viruses and begins to attack them, destroying these healthy stem cells in the process. If stem cells are destroyed and not replenished, they will no longer produce blood cells. And when a blood cell count, also called a full or complete blood count, CBC, is done, all of the blood cell counts, the red cells, the white cells, and platelets, are low. This condition is called aplastic anemia. We won't speak too much about this today, but this explains why targeting the immune system can help treat some patients with aplastic anemia. Now let's talk more about PNH. At any time, stem cells can change or mutate and develop into what can simply be called a PNH stem cell. This change is acquired and not inherited. On its own, this PNH stem cell may not cause any problems. It doesn't have any inherent growth potential, and it will remain at a very low level in healthy bone marrow. However, if that PNH stem cell is present in the bone marrow of someone with a bone marrow failure condition, most commonly aplastic anemia, in which the immune system is destroying the healthy stem cells, the attack that happens on those healthy stem cells does not occur to the PNH stem cell. So the PNH stem cells are spared. It's just like survival of the fittest. The PNH stem cells are now in the right conditions to thrive and multiply because the healthy stem cells are being destroyed. These PNH stem cells also go on to produce blood cells, the red blood cells, the white blood cells, and the platelets. But now they're called PNH red cells, PNH white cells, and PNH platelets. What is the difference between the PNH blood cells compared to normal blood cells? Healthy blood cells have a series of proteins on the surface going all the way round. Think of them as a protective shield on healthy blood cells. But PNH blood cells are unprotected. They don't have that protective shield on their surface. What does that mean for someone living with PNH? To understand why the loss of that shield is so important, you need to learn about another part of our immune system called the complement system. The complement system can be thought of as a series of proteins or defenders that protect the body by destroying foreign organisms, such as bacteria and viruses, that are inhaled or ingested. The complement system consists of complement proteins 1 through 9. Oddly, the sequence of the first 4 is C1, C2, C4, and then C3. That is not as important as their role. The complement system defends the body by marking or flagging certain foreign organisms and destroying other foreign organisms. Normally, the complement system activity has no effect on a healthy blood cell because its protective proteins shield against their destruction by the complement system, so the destructive complement proteins can be thought of as bouncing off. However, a PNH red blood cell doesn't have that protective protein shield. Unfortunately, the active complement system, especially the last part, which is called the terminal part, destroys the PNH red blood cell in the blood vessel. And that results in intravascular hemolysis, which means destruction of red blood cells in the blood vessel. Intravascular hemolysis can result in anemia in many patients. However, PNH is unfortunately much more than a disease that causes anemia. During intravascular hemolysis, the contents of the red blood cell, such as haemoglobin, come out. Nature never intended for haemoglobin to be outside of a red blood cell. It should stay inside the red blood cell. However, when the red cell is being destroyed through intravascular hemolysis, the haemoglobin is released, and then it is called free haemoglobin. Free haemoglobin can have many consequences. It can damage blood vessels as well as mop up agents in the blood, which can result in the symptoms that people with PNH might experience, such as fatigue, shortness of breath, difficulty swallowing, abdominal or belly pain, dark-coloured urine, and, in men, erectile dysfunction. It also contributes to complications in organs, such as the kidneys. The passing of free haemoglobin is one of the causes of the kidney damage in PNH. The free haemoglobin may also contribute to elevated pressure in the lungs, called pulmonary hypertension. All of these can be dangerous and even life-threatening. This breakdown of red blood cells in the blood vessels, the intravascular hemolysis, is also very importantly and unfortunately linked with thrombosis or blood clots, a complication that is extremely dangerous. There is a way to monitor for intravascular hemolysis or the breakdown of red blood cells in the blood vessels. That's because an enzyme that should normally be inside red blood cells, such as haemoglobin, is also released during this intravascular hemolysis. That enzyme is called lactate dehydrogenase, or LDH. In nearly every patient with PNH, the presence of a high LDH is an excellent indicator of how severe a patient's destruction of red blood cells is, and therefore something that should be monitored to assess the risk of complications in this disease. It's important to remember that the attack by the complement system not only occurs on red blood cells, but also occurs on the PNH white blood cells and PNH platelets, because all the blood cell types lack that protective protein on their surface in patients with PNH. Instead of destroying these PNH white blood cells and PNH platelets, the attack by the complement system activates them. This is one of the biggest causes of thrombosis or blood clots in patients with PNH and is a very serious complication that can lead to thromboses in different organs, such as the liver, lungs, heart, or brain to cause a stroke. Therefore, just focusing on red blood cells or haemoglobin would miss this important effect. All that has been described can significantly affect patients and unfortunately can result in complications that have the potential to be life-threatening. So it is important to know that PNH can be a lifelong condition. It is also important to know that PNH is manageable. With over 20 years of complement experience, Alexion is committed to patients with rare diseases.